Travis Scott.
Not Tyga?
No, they broke up.
Jamie!
Hey,
oh
what's
my God,
up?
what's up? How are you?
Good, how are you doing?
Not so good. You
What
know what
happened?
happened at Starbucks the other day?
Oh yeah, I remember that.
It happened a couple times again.
Oh really?
Yeah, it's really weird. I'm really concerned about it.
Yeah, that's not normal. We should probably like go see someone about that. Like
Yeah, will
make
you
a
go
doctor's
with me?
appointment. Yeah, I can help make a doctor's appointment for you.
Yeah, I don't think I can go by myself. I'm really worried.
Yeah.
Definition. Narcolepsy is a neurological sleep disorder which is chronic and results in episodes of overwhelming drowsiness during the day. People affected by this disorder have trouble staying asleep because of the poor regulation of sleep cycles they are attributed with. This lack of consistent sleep leads to intense and sometimes overwhelming drowsiness during the day, which is termed excessive daytime sleepiness, or EDS. During these attacks of drowsiness, people afflicted may fall asleep anywhere from a few seconds to an hour or longer. Additionally, people inflicted with this disorder may experience loss of voluntary muscle tone, hallucinations, and sleep paralysis. Narcolepsy can often be misdiagnosed due to the lack of understanding behind what causes it. It is postulated that there may be a combination of several factors which can lead to narcolepsy.
Well, we're finally here. Yeah, but it'll be all good though, don't worry. What do you think's wrong with me? I think it might be serious. No, I don't think it's anything serious. Like, the doctor will figure it out for you, but I don't think it's anything too bad.
Well, thanks for coming with me.
Ms. Smith, the doctor will see you now.
Thank you.
Hello, Ms. Smith. I'm Dr. Rhodes. How are you today?
I'm okay, thanks.
Okay, great. So all your numbers taken from Nurse Jeffords, they sounded good. Your heart rate was 60 beats per minute, and your temperature was 98.2 degrees. These numbers are definitely normal for your age group. Have you been eating differently or taking any medications?
No, I haven't.
Okay, so tell me the reason you're in today.
So lately I've been having sudden attacks where I pass out. I feel really tired during the day. I fall asleep randomly when I shouldn't. I also really can't sleep at night, and I'm starting to get really worried about it.
Have you had any other symptoms such as muscle weakness?
So sometimes my muscles do seem to fail me, and I can fall asleep really easily. It's actually been making me kind of depressed lately because I'm not sleeping very well. And my friends have been also saying that I've been kind of moody.
Okay, so I see you're experiencing some symptoms of depression as a result of your sleep loss. Any other things that have felt off lately, even if they're slight things?
Again, I'm getting tired really easily. I feel like I'm constantly fatigued, and usually I work out very regularly, but I feel like I'm not gaining any endurance or seeing any results in the gym anymore.
Okay, is there anything else you've been experiencing that you want me to know of?
No, that's all I can think of right now.
Okay, well I'll go put this in the file and then I'll be back to tell you our plan of action. Hello. Okay, so based upon your symptoms you described, I'm going to be diagnosing you with narcolepsy today.
Okay.
Unfortunately with narcolepsy there's no cure available at this point, but certain medications and behavioral strategies can help you to cope with your disorder.
Prognosis. There are no current medications that can completely treat narcolepsy in such a way that alertness is fully restored. However, the worst symptoms can be treated with a combination of medication and therapy. Most patients report that their symptoms get worse in the years following their first realization of symptoms, but many people report that daytime drowsiness and other symptoms decrease after the age of 60.
So to go forward with treatment, I'm going to prescribe you the FDA-approved drug known as modafinil. This will primarily help in your treatment by stimulating your central nervous system. However, if this drug does not work well with your body, we can later prescribe you other options such as methylphenidate, tricyclics, or SSRIs, and sodium oxybate. Also, as for the behavioral strategies I was referring to earlier, I think it would be wise for you to schedule short and regulated napping periods at the peak of your sleepiness. Also, I want you to work to try to improve your quality of nighttime sleep by relaxing before bed and definitely avoiding large meals before any sort of sleep. And then lastly, I would recommend not to drink any alcohol or caffeinated beverages before you go to bed. Any questions for me?
No thanks, I'm good.
Okay, so here is your prescription. Good luck and keep me updated with how the final medication looks for you.
Alright, thanks so much for your help.
Of course.
Treatment. While there is no cure for narcolepsy, a combination of therapy and prescribed medication can help patients cope with their symptoms. Some behavioral changes involved in therapeutic treatment include increasing the quality of sleep and taking naps during the day. Quality of nighttime sleep can be improved by relaxing before bed, keeping a consistent sleep schedule, and eating smaller, healthier meals. Furthermore, alcohol and caffeinated drinks should be avoided, especially before sleep. During the day, having a nap schedule or simply taking naps when feeling tired can reduce the symptoms of narcolepsy. The FDA-approved drug modafinil is a central nervous stimulant, which can be prescribed and taken to reduce or eliminate excessive daytime sleepiness. Methylphenidate and other similar amphetamines might also be a common prescription for people who still suffer from bouts of extreme drowsiness. The issue of cataplexy is addressed by the prescription of SSRIs, also known as selective serotonin reuptake inhibitors, and tricyclics. Some of the common tricyclics patients may benefit from include clomipramine, potriptyline, amipramine, and desipramine. Common SSRIs used to treat symptoms of cataplexy related to narcolepsy include fluoxetine, venlafaxine, and sertraline. Gamma-hydroxybutyrate, or GHB, is another FDA-approved alternative to reduce symptoms. Basic neurophysiology. When a patient is diagnosed with narcolepsy, this disorder can fall into one of two types: type 1 narcolepsy and type 2 narcolepsy. The major distinguishing factor between type 1 and type 2 narcolepsy is the presence of cataplexy in type 1, but cataplexy is absent in type 2. Both type 1 and type 2 narcoleptic patients will experience continuous excessive sleepiness. However, because of the presence of cataplexy, the person with narcolepsy may experience emotionally induced muscle weakness or paralysis, which occurs during wake. Specifically for type 1 narcolepsy, this diagnosis has been linked to the reduction in hypocretin producing neurons in the brain. About 90% of the hypocretin producing neurons are lost in type 1 narcolepsy. Hypocretin, or orexin, operates in the thalamus as a promoter of wakefulness through the firing of neurons of the nonspecific thalamocortical projection. It also inhibits sleep-promoting systems. Hypocretin neurons remain active during the waking period, which leads to an excitation of the other wake-promoting systems. In contrast, with the absence of hypocretin, the wake-promoting neurons may not receive enough excitatory drive, which reduces arousal, inhibits sleep-promoting systems through the inability to sustain long periods of wakefulness, and causes frequent lapses into sleep. Furthermore, hypocretin deficiency may result in the reduction of the CAP rate experienced in non-rapid eye movement sleep. Patients with type 2 narcolepsy, which is marked by the absence of cataplexy, have normal hypocretin concentrations. Moreover, only about 40 to 50% of patients with type 2 narcolepsy are positive for HLA-DQB10602 gene, which provides direction for the synthesis of a protein involved in the immune system, which makes it difficult to understand its neurophysiology. In general, patients with narcolepsy have a dysregulation of a neuronal system which damages the interaction between activating and inhibitory neurons. During the day, the signaling of wake-promoting neurons is lessened, which contributes to excessive daytime sleepiness and muscle tone. These wake-promoting neurons include dopaminergic neurons and noradrenergic neurons. Dopaminergic neurons are the main source of dopamine, which is a neurotransmitter involved with the brain's reward and pleasure centers. Noradrenergic neurons are activated by norepinephrine that acts as both the stress hormone and a neurotransmitter. At night, GABAergic neurons, which is an inhibitory neurotransmitter that generates gamma-aminobutyric acid, are active and inhibit the wake-promoting neurons to reduce alertness and skeletal muscle tone.